If you've been diagnosed with diabetes, it is essential that you check your feet every day. Minor problems like scratches can become infections. Infections can lead to an infection of the whole foot, and this can lead to hospital admission. All of the advice in this video follows national guidelines on diabetic foot care and self-assessment. Check your feet in good light and wear glasses if you require them. Begin with looking at each toe and toenail. Long nails can pierce the skin, which can lead to infection. Next, check in between your toes. You are checking for any cracks or fissures in the skin. Once you've examined the top of the foot, examine the bottom of the foot. If you find this difficult, then you can use a mirror. You are looking for any kind of cuts, abrasions, redness, or bruising. If you have a family member or a friend, they can also check your feet. Aside from checking the skin at the bottom of the foot, you should also check the bony areas around your ankle, the back, and the underside of your heel, and especially the ball of your feet and toes. These are areas of the foot that can easily be affected by pressure from ill-fitting shoes or from pressure from an underlying mattress. Diabetes can cause nerve damage. This can mean you could lose sensation or experience tingling, burning, or stinging sensations on the foot and arms. You can examine yourself, if able. Use your index finger to touch each toe on both feet. You should be able to feel light touch. If you cannot, that can indicate early nerve damage. In this case, you must report this to your clinician. It is important to maintain good foot hygiene. Do not soak your feet, as this can damage your skin. Wash feet daily, but check the temperature of the water. A handy tip is to use the inside of your arm to check the temperature of the water before you wash your feet. Hot water will damage the skin. Rinse your feet thoroughly and dry them carefully, especially between the toes. After you've washed your feet, pat dry your feet with a towel. Any rubbing motion on the skin might cause an abrasion. Make sure to dry in between the toes. Apply lotion on the bottom and the top of the feet, but do not apply lotion in between the toes. It might cause the area to become too moist. Cut or file your toenails regularly, following the curve of the end of your toe. Use a nail file to make sure that there are no sharp edges which could press into the next toe. Do not cut down the sides of your nails, as you may create a spike of nail which could result in an ingrown toenail. Always wear socks with shoes and make sure you change them daily. Make sure the socks are seamless to reduce friction. The tops should not be elasticated, as that can pinch into the skin. Wearing comfortable shoes are important. If they are tight, they can damage the skin and result in infection and even ulceration. Shoes must be of a good quality so the weight of the body can be distributed evenly around the foot and there is no significant pressure around the smaller parts of the foot. Make it a habit to always check the inside of your shoe anytime you're wearing them. This is to make sure there are no foreign objects that could hurt your feet. Check the bottom of your shoes before putting them on to make sure that nothing sharp, such as a pin, nail, or glass, has pierced the outer sole. Check your feet every day for any blisters, breaks in the skin, pain, or any signs of infection, such as swelling, heat, or redness. If you develop any of the following problems, such as a red, hot, swollen toe or foot, a break in the skin that doesn't heal, new redness or discoloration of your toe or foot, new or unexplained pain in your foot, it is important that you contact your multidisciplinary foot care team, a local podiatry department, or GP for advice as soon as possible, within 24 hours. Daily checks of your feet result in being able to notice any changes in your foot. Do not hesitate if you observe any changes and contact your clinician to resolve this immediately. Some diabetic foot problems can be treated quickly and easily. However, some problems can lead to open sores, hospitalization, surgery, and loss of limbs. In order to avoid this, checking your feet daily is now part of your routine as a diabetic.